I'm Suzanne Clough. I'm the Chief Innovation Officer for Armada Health. Basically what we're trying to do is we're trying to find the right physician for the right patient for a specific condition. And I use the word right in the most profound context of that word. So where we use machine learning is, how do you define right? You know, that we have these buckets of data out there that may describe where a physician trained, or outcomes data for a given procedure if it's there. But healthcare is complex. You know, these are complex temporal relationships. It's dependent on interactions between all these humans, right? Physicians and patients. It also depends on the health system, the type of condition. So when you think about all the complexities that go into what could actually drive good clinical outcomes, some of that is just beyond human computing, right? So we as humans and clinicians can help our machine say, look, we have some hypotheses of all these different domains of interactions. We have some hypotheses about how some of these interactions may actually improve healthcare, drive down costs, but we need the machines sometimes to help us then test these hypotheses and drive insights. So we really have a narrow focused approach with AI. We don't believe artificial intelligence is the end all be all, at least in our company, but we recognize its importance, and we really try to leverage it to gain insights in what drives a great physician-patient match. To kind of ground in reality, another way that we use machine learning, or the way it shows up, is think of what we're doing as kind of the eHarmony of patient-physician matching. You know, back in the day, before the Tinder and the swipe right and swipe left, you know, the big thing was, how can we learn about people's personalities and likes and interests, right, and match them up in a love relationship. And that's what we're trying to do here, is this precision matching. And we need modalities like machine learning to help us really understand what makes people tick. You know, what about this patient and this physician beyond the obvious clinical match? You know, what can we learn about what really would drive a meaningful experience for the two of them once they got together?